Learn efficient pharmacology, pharmacokinetics part 9, enzyme induction and inhibition. A major challenge to human survival is that the human body is exposed to more than 1 million xenobiotics during its lifetime. Can you guess how this is addressed? The first solution is obvious. Many different types of enzymes or enzyme isoforms for metabolism. That is, multiplicity of enzymes. The CYP family that we discussed earlier has more than 50 isoforms. 50? 50 is way less than the million xenobiotics the body may be exposed to. For that problem, there is another brilliant solution. The xenobiotic binding sites within CYPs are large and fluid. That is, one CYP can metabolize many different xenobiotics. We can call this broad substrate specificity. Thus, a few CYP isoforms can metabolize the majority of the drugs. The CYP isoform CYP3A4 alone is responsible for the metabolism of about 50% of clinically used drugs. But this broad substrate specificity creates a major problem in clinical practice. When two drugs interact with the same enzyme, one drug can inhibit the metabolism of the other. This may increase the plasma levels of the unmetabolized drug and lead to toxicity. Thus, with multiplicity of enzymes and broad substrate specificity, the body is capable of metabolizing the vast variety of xenobiotics that a person might encounter. Now, imagine a scenario where a person is exposed to one particular xenobiotic in high amounts for a long time. How do you think the body will handle that? One solution is to synthesize or induce greater quantities of the enzyme that can metabolize the xenobiotic. This is enzyme induction. Imagine the problems this can cause in pharmacotherapy. A drug may induce its own metabolism. This is autoinduction. We know that CYPs have broad substrate specificity. So, if the enzyme metabolizing a particular drug also metabolizes other drugs consumed by the person, the metabolism of those drugs can also be enhanced. And sometimes a xenobiotic may induce a different enzyme that metabolizes a different drug. How this happens has been explained at the end of the video in the section on good to know facts. Such enhanced metabolisms may cause the plasma concentrations of drugs to fall dramatically. This table gives us some examples. Pause the video to view those. Did you note that the effect of enzyme induction is not limited to xenobiotics but may extend to endogenous compounds? Also, did you see how enzyme induction can sometimes be advantageous? One last question before we end this video. Where did this drug metabolizing enzymes come from? Enzymes are proteins, and proteins come from genes. So, can genetic variations among individuals affect drug metabolizing enzymes? Absolutely. These variations can affect the rate of drug metabolism. Unlike most individuals who metabolize the drug normally, a few may metabolize a drug slowly, while a few others may be rapid metabolizers. This can affect drug efficacy and may also precipitate toxicity. Sometimes the drug dosages might have to be changed too. We shall discuss the effects of genetic variations on pharmacokinetics and pharmacodynamics in detail in a later video. Here are some good to know facts. This is a summary of our discussion.